Good morning to all. Now we are going to see about the introduction to nursing rounds. This is the picture of how the nurses and the superintendent they are conducting the nursing rounds. Nursing rounds, a small group of nursing professionals assemble on the patient bedside to discuss the routine nursing care provided to patient so that efficient nursing care to be ensured. Meanwhile, the nursing students can also be taught about the nursing care. Nursing round is an excursion into patient area involving the students' learning experiences. The definition of nursing round. The nursing round is one which presents an overview of certain aspects of the nursing or medical care of all patients on the ward or of selected patients. Next, we will see about the purpose of nursing round. We will observe the physical and mental condition of the patient as well as the progress of the patient from day to day to observe the workload of the staffs. And we made the specific observation of the patient and give report to the doctors regarding the wound, drainage and bleeding from the site of the wounds or injury. We will introduce the patient to personnel and vice versa to carry out the plan made for the care of patient. We will evaluate the results of treatment and patient satisfaction. We ensure the safety measures are employed for patient and personnel. We orient the nurse and student in taking charge of the patient's treatment and status of the patient. We will teach the nursing students or hospital staff regarding the specific condition. Next, we will check any preventable condition in patients such as bed sore and foot rubs. We will check the emergency equipment that near to the patient side, whether it placed safely, whether it is under working order. We will carry out the demonstration of therapeutic procedure on patient or for the patient. We will learn about the disease pattern of care as well as treatment. We will demonstrate the effect of drugs used in the treatment. We will compare the clinical features of disease in a patient so that students they can gain better insight about that particular condition. We will prescribe any modification in nursing action needed to improve the condition of the patient. That's all about the purpose. Next, move on to the factors that should be considered while we are conducting the nursing round. Always before conducting the rounds, we have to consult the student's previous clinical experience to avoid repetition and to add to earlier experience. Always you have to keep in mind the probable value and availability of clinical material while conducting rounds. Explain the plan to the patient. Prior information is very essential and we have to get the consent from the patient. Next step, we have to introduce the patient to the group. Make the patient to feel important. Then the patient has to feel very safe and secure and privacy also it is very important. After conducting rounds, have a post conference for summary and further explanation. You have to record the nursing rounds in the ward teaching records. Next, move on to the types of nursing rounds. There are 4 types of nursing rounds: matron rounds, nursing management rounds, patient comfort rounds, teaching rounds. First one is matron rounds. Why we have to conduct? Why are they are conducting these rounds? Which can provide the opportunity for the senior personnel to achieve key aspects of their role. These include ensuring professional and clinical nursing standards and infection control procedures. Next, move on to the nurse management rounds. So here the nurse in charges with the staffs they are conducting the nurse management rounds. Every shift they are conducting this round to seeing the condition of the patient. It gives the overview of the condition and the needs of the patient. Based upon that, the staffs they can able to do the activities to meet the needs of the patient. Next, patient comfort rounds. This round should be conducted every 2 hours once. Take as example, we have to start from the morning. Morning we have to go to the patient bedside and we have to assess the patient and we have to enquire the patient whether the patient is feeling comfortable or the patient or else the patient needs any other devices or equipments or measures to improve their comfort level. Next, after that you have to go and check it during rounds. Next you have to lunchtime, evening and night. Before patient going to the sleep, we have to one more time go and do the rounds. Next one is teaching rounds. Teaching rounds, we are conducting this rounds for the junior staff as well as for the students. So they are learning from the real life experience and also it helps them to teach. At the same time we have to evaluate the nursing services. It is useful in developing clinical practices and evidence-based nursing care. Thank you all. Next PowerPoint we will see about the continuation of nursing rounds. How we have to conduct the nursing rounds. Thank you all.